My name is Chandra Mole. I work at the WHS in the Department of Sexual and Reproductive Health. I work in the area of research in WHO, and I manage the work on sexual and reproductive health of adolescents. And our work is based on is about developing evidence on SRH among adolescents, and we work with different countries to strengthen the program so that we can use evidence to improve the program so that we can contribute to the betterment of the adolescents' health. And one of the key projects in our portfolio is the global study of the global study on the youth health. We work with the School of Public Health, and one of us presented the objectives of the study that was done for 12 years. And as I said last week, we shall have enough time to discuss with Kara, and between us, we can also have discussions, because the last time we only had a few minutes for discussion. Today, we shall try as much as possible to have 2 or 3 parts of discussions, and we also hope that you will share your perspectives. Therefore, we shall have a session of sharing experiences, and we also hope that we shall hear your points of view as well as your questions. Next slide, please. Kara is the Deputy Director of the study on adolescence in the world. She works at Johns Hopkins Bloomberg School of Public Health, c'est-à-dire à l'école de la santé publique Johns Hopkins Bloomberg. She speaks French very well. Therefore, you can have 45 minutes of interesting discussions. Therefore, I give Kara the floor so that she can educate us or inform us. And
merci beaucoup. Over to you, Kara. Welcome.
Merci pour la présentation et pour l'opportunité de parler avec vous tous aujourd'hui. Oui, comme Chandra a dit, je m'appelle Kara Hunterson. Je suis l'Assistant Study Director du Global Early Adolescent Study. Et je pense que quelqu'un va m'aider avec la présentation aujourd'hui. Trevor, can you share the slides? Just start with the first one. Donc, aujourd'hui, je parlerai du GEAS, en particulier de la manière...
Sorry, Kara. Trevor, can you please use the slide set I sent with the French translation of the slides which had not been translated? I sent it to you as well.
Chandra, I made a couple of edits, and I'm sorry that first page isn't translated, but the rest should be in French.
Okay. Go ahead, please.
Bon, donc, comme j'ai dit, aujourd'hui, je parlerai du GEAS, en particulier de la manière dont l'étude a été conclue, de l'élaboration de mesures et de sa phase actuelle de collecte de données. J'ajouterai également que mon français n'est pas parfait. Donc, si vous avez des questions auxquelles je pense pouvoir répondre plus clairement en anglais, je demanderai au traducteur de m'aider un peu. Et aussi, comme Chandra a dit, c'est vraiment une discussion et j'invite vous et mes collègues de répondre aux questions avec moi aussi. Bon, donc au premier, nous commençons la collecte des données au début de l'adolescence, car il y a un manque de données sur cette période critique de développement entre les âges de 10 à 14 ans. Alors que les processus biologiques qui subsistent, les adolescents sont les mêmes, les contextes sociaux dans lesquels ils se produisent varient considérablement. Dans toutes les cultures, c'est dans cette période que les normes, les rôles et les attentes de genre solidifient. Next slide. Next slide, please, Trevor. Thank you. Donc, qu'est-ce que le GIS? Il s'agit d'une étude longitudinale, ce qui signifie qu'il y a plusieurs vagues de collecte de données sur une certaine période. Et le GIS examine les facteurs aux jeunes adolescents et en particulier les normes de genre qui façonnent un développement sain tout au long de l'adolescent et au-delà. Il permet une comparaison globale des indicateurs de santé des adolescents en utilisant les mêmes mesures. Enfin, il comprend l'évaluation des multiples interventions transformatrices en matière de genre menées dans les sites GIS. Next slide. Bon, ici, il y a les indicateurs clés de la santé et du bien-être qui sont dans l'enquête GIS. Donc, il y a le sexualité saine, qui comprise confort et fierté corporelle. Il y a aussi la santé sexuelle et la santé mentale. Aussi la scolarisation et la violence basée sur le genre et la violence interpersonnelle. Next slide. Bon, donc maintenant je vais parler sur phase 1 et c'est la phase au cours de laquelle nous avons développé les outils de genre et de santé utilisés dans l'enquête aujourd'hui. Donc, nous avons mené la recherche formative dans 15 pays sur 5 continents, tous dans les communautés urbaines qui sont défavorisées. Donc, sur la carte ici, vous pouvez voir les pays et les villes dans lesquelles nous avons fait le phase 1. Et bon, maintenant, on parlait de l'utilisation des entretiens narratifs pour explorer les normes de genre chez les jeunes adolescents.
The young adolescents.
Donc ici, c'est la
Here, we shall present the methodology that we used to develop the gender scales. You will see that we used two major methods. First of all, they are descriptive interviews, and number 2 is discussion groups. Therefore, we have the descriptive interviews which were analyzed based on gender, and they were organized along key questions based on the people's comments. And the focus groups were used to develop a series of questions that were to be discussed by people. Therefore, we shall talk about it later. Therefore, I will talk about the results of the research, because we therefore talk about the results that we categorized in different groups. There is something that we call a hegemonic myth. This means that we have environmental forces just like the schools, parents, media. This myth strengthen the hegemonic myth that paint boys as stronger than girls. Even in sites where we went, we recognized that girls are vulnerable. The girls represent sex. This means that everywhere in the world, the boys are considered as predators and girls are represented as targets. And these messages support the power division between the two, and this promotes sexual segregation too. And then we have restrictions of movements for girls, and this is based on the adult perception of vulnerability of women in almost all the sites. Therefore, the girls' mobility is very restricted compared to that of boys. There was a girl in one site in Egypt who said that a girl cannot go out as she wishes, because if a girl comes back later, the parents shall be very, very disappointed. And we also have sexual separation and mobility restriction. Therefore, as far as sexual vulnerability among the girls is concerned, many girls are told to remain at home, and there are sanctions if the girls do not do what they are told. Therefore, they are socially isolated, and at times they suffer. Therefore, boys and girls deplore this situation. Yet, when they were children, they used to play together, they were friends. But now, when they are in puberty, this friendship is not legitimate.
Next slide. Maintenant que nous avons ces résultats,
with these results, we would like to see how we can measure the prevalence of these normative beliefs amongst the young adolescents. This is what we did in the next phase of the normative research. The first one was formative. Here, we have empirical questions on gender scales. The first question is, are there no gender norms that are common in all cultures for young adolescents? And the second question is, how are these norms related to adolescent health, such as gender-based violence, sexual health, and mental health?
donc, the norm de genre.
Gender norms. The concept of sexual double standards has been researched on severally, and it's actually considered as norms that judge the sexual behavior for women and girls. Men are positively evaluated than women for having the same sexual behavior. For this study, we developed terms that can be used to evaluate these norms amongst the young adolescents. These are the components of sexual double standard that led us to the results of the first phase. We asked the adolescents how they agreed or disagreed with the following statements. And based on the quantitative results of this process, we came up with a scale, and therefore we can see what the responses were. The second scale was about the normative expectations of the adolescents. The issue here is to know whether adolescents have expectations or different judgment on intimate relations. We have some questions, and it was asked to evaluate intimate relations. And we have not used this scale. We do not use this scale a lot because with very young adolescents, it's rare to have intimate relations at that age. But we use this scale to evaluate how the intimate relations change during the study period.
Next slide.
Here we have the gender stereotypes. These elements show the different beliefs for girls and boys. They show perceptions, what adolescents should do and what they should do depending on their sex. We can see what they said here. Here we also have stereotyped roles based on gender. The difference here is about traits and roles. We have stereotyped roles that represent a specific behavior that are meant for girls and boys. These go beyond some characteristics. This is about what the boys and girls should do and not at home, and even in the community. Therefore, we asked the adolescents if they were in agreement or not as far as these items are concerned. And this was the same thing for sexual double standards and for intimate relations, and the stereotypes based on roles, and we calculated the scale, and after that we carried out the average of the study population. Therefore, this is how we came up with gender norms, and therefore after that we did a study on empowerment. Therefore, GEAS also covers empowerment, and this study uses the definition of World Bank, which is defined as follows. It's the process of building the individual's capacity of a group to make efficient choices. This means that they need to make choices that transform their choices in actions and results that are expected. Therefore, this is a very important definition. First of all, we have autonomy, and autonomy is the capacity of an individual or a group's capacity to make informed choices and act according to the values. And number two is the structure of opportunities, and this is the institutional context, social context, policy context of rules, and as well as no formal and informal norms in a society that influence action. Therefore, in GES, we identified the three specific areas that are relevant to this age group, and therefore the three are the bodily control and the freedom of movement. Therefore, this means the capacity to be heard. Here they say that I can speak at school and make a comment or respond to a question. And number two is that I can ask for help from adults when I need it. That's the capacity of being heard. As far as the freedom of movement is concerned, this is if the adolescent can go to a place where they wish. Here, we have items like, can you tell us the frequency with which you are authorized to do what follows without an adult? To go to a party for boys and girls, to go to church, to the mosque, the temple, or to a religious center. And number three is decision-making power. This means this is about behavior control. The item is that at which frequency are you capable of taking the following decisions without the adult's input? Here we have the GEAS empowerment framework. We come back to the definition of empowerment as defined by World Bank. The empowerment is the process that improves the capacity of the person to make good choices. The conceptual framework of GS integrates gender as measured by freedom of movement, expression, and decision-making in the opportunity structures of the socio-economic environment. Therefore, we have the opportunity structure of an adolescent to shape the realization of the expected results. Therefore, here I will stop so that people may react by asking questions if they so wish.
Merci, Cara. Merci beaucoup.
Thank you, Cara. Can we stop sharing so that Cara, can we stop the slide so that we can have our videos on, so that we can have the discussions?
Donc, commence avec un petit synthèse.
I will begin with a small summary. Cara was talking about the global early adolescent study. She began with the presentation of objectives, and before that, she presented the formative research. And after that, she talked about three issues. The first one is sexual double standards. She talked about gender stereotypes, and she also talked about can you explain the difference between the sexual double standards and the gender stereotypes? And to end, she talked about empowerment. And clearly, what is important for the adolescents? We have empowerment for, there's also the issue of empowerment to women adults. Therefore, we have enough time. As I said, we said that we can take 10-15 minutes to discuss, and after that, Kara will present the next 15 slides. Therefore, I would like to say that since we have questions, we shall share the slides in English, in French.
Et nous partagerons un ensemble de 5 articles de journaux en anglais et en français. We will share 5 journal articles in English and in French. Et est-ce qu'on peut commencer avec quelques commentaires?
Can we begin with some comments from participants? Yeah, there are questions, comments. For example, we can begin with my friend and my colleague Suleiman, who works in the area of sexual reproduction. We discussed different things, Suleiman. Can you share your reactions? And after that, Suleiman talked. Then we have Robin, our colleague from DRC. And to end, we have the comment from Lulebo, who is involved in this study in DRC. And then after 3 or 4 comments that will be short, Kara can explain the reactions. Suleiman, you have 2 minutes. Good evening, everyone. Here we are in a small meeting and therefore did not.
On peut me dire, donner la question pour que je puisse intervenir. Sinon, je passe la parole au suivant pour éventuellement intervenir plus tard.
La question, merci Suleiman. La question est, quelle est la relevance de normes de genre?
Gender norms.
Des jeunes adolescents dans le travail que tu fais au Bénin, le travail.
Young adolescents are concerned in Benin. Thank you. Robert, are you ready to share some reflections?
Robert?
Robert, je pense que tu peux parler maintenant.
Robert, you can speak.
Ou est-ce qu'on peut avoir des commentaires de Aimé Lulebo? Aimé Lulebo, est-ce que vous pouvez...
Can we have comments from Aimé Lulebo?
Partager vos perspectives.
Là, vous m'entendez?
Are you getting me? Yes, yes, we are getting you. Thank you for the floor. What do you do and what is the relevance of gender norms in the work that you do in DRC? After that, you can have a comment from people who work at the University of Kinshasa. My name is Dr. Robert Kanke. I work for WHO in DRC country office, and I'm in charge of adolescent health. As far as you are low.
Je disais, je suis docteur Robert Kanke. Vous m'entendez?
My name is Robert Kanke.
Oui, je suis docteur Robert Kanke. Je travaille pour le compte de l'OMS. Au bureau.
My name is Robert Kanke. I work for WHO in DRC. I'm in charge of youth and adolescent health. As far as the gender aspect is concerned among the adolescents, this study is very interesting. The information that was shared is very interesting, and particularly in DRC, sorry.
Il y a des perceptions différentes en fonction du milieu où on se trouve. Ça veut dire que qu'on soit en milieu urbain ou en milieu rural.
Therefore, in urban areas and rural areas, there are differences.
Par rapport au milieu rural.
Therefore, as far as rural areas are concerned, I would say that we have problems in terms of early marriages. What does this mean? From the beginning, as far as the sexual relations are concerned, there are provinces where early sexual relations accepted for boys and not girls. Kara talked about double standards. That's it. The second thing is the same thing for the girls. We have it's the same thing for sexually transmitted diseases, because if a boy has such a disease, people would say that he will be proud, because people know that he has many partners. For the girl, is different. And then another problem is access to services. For example, when you see young boys, they go there. Therefore, if they go to hospital when they have sexually transmitted diseases, people don't ask them many questions. But for girls, there'll be stereotypes, and therefore this is why girls do not go to hospital when they are infected. Thank you, Robert. Therefore, you talked about the empowerment when one is married at 14 years, because when you are married at 14 years, you do not have time. You also talked about double standards. Can we have a comment? Do other participants have comments to share?
Merci, Chandra.
Thank you, Chandra. Are you getting me?
Oui. Au fait, je suis vraiment en train de rentrer du terrain. Si
I have just arrived from the field. If I have to talk about gender norms, I would like to say that the GS study, it's the first study in DRC that measured the gender norms, and which also measured this in young adolescents. Therefore, we could not imagine that gender norms were among the young people. Therefore, we noted that gender norms are very high, frequency is very high, and there's also the disparity that we observed between boys and girls. And since we have a webinar on 30th March, the professor will present some results and will see that it is a problem that exists and which was never measured. And therefore, with the intervention that was carried out in the framework of this study, we shall measure this study, and there was an intervention that was put in place to correct some of these things, and there are certain norms that have not been corrected and which persist despite the intervention in place. Therefore, this is a problem that exists among the young adolescents. Therefore, we need to continue thinking on interventions that shall be efficient so that progressively we can correct these norms. Thank you very much, absolutely. And next week, we shall talk about interventions. And I think that we shall have the University of Ouagadougou. Therefore, we shall have presentations of studies that were carried out. The last comment by someone. Is there someone who would like to share the reaction? Thank you, Aimé, and thank you, Robert. Thank you, Chandra.
Très bien. J'ai bien
Thank you.
compris. Moi, je suis Suleiman Zan.
My name is Suleiman Zan.
L'OMS au Bénin.
I'm in the Benin WHO country office, and currently we are putting in place an initiative whose objective is to improve access to sexual and reproductive health, especially access to medical abortion, so that it can reduce maternal mortality. And recently, the laws were voted in Benin in the National Assembly to protect the young girls, to therefore strengthen therefore their rights. Therefore, there are many things in favor of girls, women, and vulnerable groups. And therefore, we were able to improve conditions of access to medical abortion in Benin, because when the pregnancy has negative effects, be it economical, social, and what have you, the law is very clear, and therefore people can seek medical abortion. And I think that this can be an example for the sub-region, even for Africa. And finally, we have the sexual and reproductive health education in primary schools, and this began as a pilot phase in some schools in the country. Thank you very much. In Benin, they have laws, and they have begun sexual and reproductive health in schools, and the WHO works with the Ministry of Health with the Ministry of Education to see how they did it. We have Usman Sila, and after Usman, I'll give the floor to Kara. And Kara, you can react to comments and explain the difference between gender stereotypes and double standards. What are the differences? Usman, you have the floor. You have the floor.
Usman Sila.
Usman Sila.
Okay, merci beaucoup.
Thank you very much. My name is Dr. Usman Sila, in charge of youth and adolescent health in Mali. The last demographic health information shows that the youth are represent a very huge percentage of the population, and that they are very fertile. And we have about 300 maternal deaths for 1,000 births, and therefore you can see that adolescents contribute highly to neonatal mortality. Therefore, we have in our department, we have carried out a certain number of activities, and among these, we would like to evaluate plans so that we can measure the youth and adolescent health. We also have a partner who helped us to develop training modules so that we can do training on youth-friendly services. Therefore, we have this concept of youth and adolescent health because we know that adolescents are exposed to several factors that could be harmful to them. What we have is financial deficit in Mali, and unfortunately, the initiatives that are there are not very coordinated but if we get funding, we can improve the condition of youth and adolescents in Mali. Thank you, Usman. It's very interesting. And then I'll give the floor to Kara. She will explain the childhood experience. You talked about the immediate implications, and Kara explained the implications that will come after 25 years. And therefore, during the second part of the discussion, maybe Senegal can share its perspectives.
Thank you very much. Thank you very much, Chandra. Should I now answer all the questions about the difference between double standard?
Ok, très bien. Donc, la différence entre...
So the difference between double standard and the stereotypes is that double standard has the same behavior that are treated differently if they are practiced by a boy instead of a girl. For example, in the sexual activity, the girls are punished, but when we talk about boys, they are rewarded. But the stereotypes are actually different ideas when we look at the roles of boys and girls. So here we are talking about the different ideas, what boys and girls should or shouldn't do. So double standard, it's actually the same behavior, but stereotypes are different behavior between boys and girls. Thank you very much, Kara. Another question? Because there are three things. There are three things that are similar in the studies in different countries. For example, the global early adolescent study that is done in Belgium, in DRC, in ECOWAS, in Burkina Faso, in India, in Egypt, in Kuwait. So what are the 3 or 4 things that we find everywhere? So before starting, people say that we cannot compare. Is that true? Or we can actually compare? Yes. So what I'm talking about right now is that the first phase is that that's when we did the study and the survey for 15 countries, and we've seen that the scales and the sexual double standard and the empowerment and all the items that I've already talked about here are found in all the countries. So it's very important in all the countries. But the comparison that we are doing right now is if we use the same thing that I've already explained here, we have the capacity to compare the difference between the countries and the difference in how frequent are the difference between the boys and girls, and how we can see the difference with the same measures. So that's how we're going to compare with all the countries and also with the different cultures. We can use these measures to compare on the same ideas. So the results can be different, but the measures are the same. Thank you very much, Kara. Can you continue with your presentation so we can see the same things everywhere, but the manifestations are different, and maybe the level is also different, for example, for the double standard. Thank you. Like Chandra said, we are going to talk now with the adverse childhood experiences. That's a measure and I will say it in English.
Ça veut dire also ACEs. Et
It's also ACEs, and ACEs have become very important measures for development, and it's most of the time included in the study that examines the relationship between the stress factors that came during the childhood and the negative results for the health of the adults. So I can tell you that few studies have been done about the relationship between the ACEs and the results for the health of adolescents. So few studies that ACEs have led in many of the countries. So there's a relationship and other responses in the adults, especially for countries with high revenue, and we have negative results for health.
Oh, next slide. Sorry, Trevor. I was just talking about that slide.
Next slide. Sorry, Trevor. Next slide. And so that's that I was just talking about. With the GEAS, we have used the data of 1,284 participants in the pilot study, and it was coming from 14 sites and 5 continents. We've also evaluated the prevalence of ACEs at the adolescents aged 10 to 14. We also see the countries. We also evaluated the various associations with the depression symptoms and violence, and you can see the countries in that slide. Next slide. Here you can see the various components of ACE. We talk about being exposed to negligence and violence, and also the emotional abuse and also sexual abuses. So here we're asking if we have experiences here during the childhood, and we can compare if we have these experiences here, if the experiences are associated to the health measures during adolescence and also during the adulthood. So we can see that we have toxicomany, we have also issues of domestic violence and instability within the house. And we can see here other elements of that are included in the ACEs.
Next slide.
Next slide, please. So here we have the key messages that we have seen with the GAS. The first thing is that the exposition to the ACEs are really high for the young adolescents that live in the disadvantaged communities. Boys talk about more of these negative exposures during the collective. Go back, please. And then we have the exposures of ACEs that are positively associated in the interiorization, basically the depressing symptoms for the girls, and the exteriorization behaviors like violence for the boys. So here we can see that girls have ACEs, but boys are more exposed to negative experiences compared to the girls. So most of the time we talk about girls' issues, but these messages said that boys also have problems. and
attention.
we also need to give them some attention, because most of the time we give attention to the girls. We also need to dedicate some time to the boys so that we can actually sort out the problems that exist in adolescence stage. Next slide, please. And finally, we're going to discuss.
Ici, vous voyez le
Next slide.
processus de développement.
Here we can see the process of the development during the discussion groups, and you can see that the people were actually in the core of the discussion. They share their reflections, their opinion, the issues that we need to include. It also gives some stories, scenarios that we need to take into account. So we had group discussions that took 3 days, and it was a mixed group. We had boys and girls in each group, and the stories were compared between the sites, and common stories were actually identified. And initially, we had 6 themes that were identified, and we reduced them to 4 themes after pilots, after we've piloted them. So we have now 4 like themes as such that we use in the GAS, and the 4 aspects are the same for each site. So here we can see the various themes. The first one, it's romantic interest. The second one, it's the sex that is not in diagonal. So it means the girls that behave like boys, and boys that behave like girls. And then we have puberty, and then satisfaction and shame, and then pregnancy, reaction, and responsibility for the pregnancy for girls. Next slide. So here we have things that have been included in all the thumbnail, and to have like a representation of the situation. So these images were applicable in other contexts, and even though the norms were modified in certain cases so that it can be appropriate for the adolescents. So the last part of the presentation is to talk a bit about the phase 2. That's the longitudinal phase. Here, it's this is the key questions about what we're actually doing for phase 2. And I can tell you that this is very important so that we can understand our raison d'etre. So the first one, what are the factors that are linked to the gender, the norms for equitable and inequitable genders? The second one, how does it vary according to the sites? And we also have the various norms and the perception of equality of gender, and how does it move with time? And how are things perceived at the individual level, and how the intervention, the transformation intervention as far as the gender issues is concerned, and how does it affect the various health trajectories for boys and girls. So Aimee talked a bit about the interventions in DRC, and she's going to talk about it during the 3rd webinar. So when we'll have the webinar next week, we're going to learn more about the intervention in DRC. So it will help all of us. Next slide. Now I'm going to talk about the objectives of phase 2. In this site, we work in 11 countries, and we have various intervention sites and research sites. And I can tell you that we also have a research component, and here we can see the various intervention partners. We have Save the Children, and actually Institution for Reproductive Health in DRC. We have Promundo in Malawi, Population Council, and APHRC in Kenya. We have Rutgers, Netherlands, Indonesia. We also have Institute for Women and Ethnic Studies in the USA. In next slide, we have a map where you can see all the sites, and we can see here the different colors between the various sites where we have interventions and the sites without interventions. And the next slide, I think, is the last slide. In this phase, the group is still of
les communautés urbaines pauvres de chaque site. La plupart des adolescents sont recrutés à l'école, tandis que dans un site, nous inquiétons également sur les adolescents non scolarisés, et ça c'est à Kinshasa, en RDC. Pour cette phase, le travail est vraiment dirigé par nos sites, car ils sont les experts de l'engagement des jeunes dans leur communauté. Pour cette raison, nous nous appuyons sur des organisations communautaires pour le recrutement et le suivi. Et le collecte de données, nous avons au moins 3 vagues sur 3 à 5 ans. Et maintenant, nous sommes dans la 5e an de phase 2. Donc, nous avons commencé en 2017 et maintenant, nous sommes en train de finaliser l'enquête dans la plupart de nos pays. Et maintenant, nous allons commencer le 5e vague à Kinshasa dans avril. Donc, Aimé peut parler de les résultats. Aimé et Eric peuvent discuter les résultats de les vagues 1 à vague 4 dans le webinaire la semaine prochaine.
Merci, Cara. Merci beaucoup. Est-ce que je peux avoir la vidéo, s'il vous plaît? Merci beaucoup. Et la dernière diapositive, Cara a partagé des différents partenaires. Elle a partagé aussi le fondateur. Et un petit synthèse. Et je veux commencer par dire que Caroline Kyobotungi, directeur exécutif de APHRC, est avec nous. Bienvenue, Caroline.
Welcome, Caroline. After the short summary, maybe we'll be glad to share with us some perspectives of work that the colleagues shared with us. So I'm going to answer 2 questions, and maybe Cara will also answer. So the concern of about the romantic relationship in the adolescence period. So maybe Barrel and can say something. Caroline can also say something, and I also say that our colleague from Senegal will also say something. So in 2 minutes, please. So the second part of the presentation, Cara talked about negative experience in childhood and the implications of this experience in this negative experience in long term. Then long-term implication, that's not something that we forget easily. And basically it's not something that we have effects just for a few weeks and few months. Maybe these effects can continue for the next next 20 years, 30 years, and even for life. And when we talk about the negative effects, we can even pass it on to our children. And the second thing that she talked about it's inequality, gender inequality. She talked also about the second phase for the young adolescents. So I'm going to answer two questions that you've asked. What is the relationship between the education, the skills, the life skills, and empowerment? So to answer that question, allow me to go back to the definition of the World Bank. Cara explained the definition. Empowerment has two components. First of all, we have the personal component. It's individualistic. And the second thing, we have the environmental component, the possibility to do things as an individual. And we also have the educational life skills. Education, the way we call it, will enable us to develop a person.
Ne peut pas changer la vie d'un enfant, un adolescent, si l'environnement ne lui
permet of the adolescent if the environment does not allow the person to change their behavior. For example, a young girl can learn many things through the various groups she belongs, but if there's not a place in the school, if there's no place to work, if there's no development, and she can the only means to survive it's to get married early. And the second question: what are the problems through which all the adolescents in different countries are facing? First of all, I would like to say I can tell you that the world of girls is shrinking. They don't have the permission to go out, but the world of the boys is very large. They have the possibility to go outside. So if we can see in Europe, in West Africa, in India, in Asia, everywhere it's the same. The second thing, girls and boys need to behave in a different manner. When we talk, girls need to be modest, they need to be quiet, and boys need to be courageous, they need to be bold. And the stereotypes, and the third thing, it exists different norms to start a romantic relationship, double standard, like we said. A boy can go and to tell a young girl, I'm very attracted to you, can we go tonight somewhere? And they say it's courageous, but if the girl says the same thing, we will use expressions, the bad expressions towards that young girl. So that's it. So Cara, I don't know if you want to talk now, or we can invite Caroline. Catherine?
Catherine, are you there? Would you like to say a few words?
Yes, I would like to say a few words and to thank
Catherine va parler en anglais, je pense. Go ahead.
Catherine is going to speak in English.
Yes, I would like to thank everyone for this webinar and to thank the project's teams and the partners. This is work that has been going on for quite some time, and it's great to see the results as they come out in some of the West African countries, because for many years we've been doing work outside West Africa. So it's good to see that after a few years of establishing our presence in Western Africa, that we are having this kind of event to showcase some of our work, but also to understand better some of the problems and challenges that young people face in different parts of Africa. So I'm out here to listen to the results.
Je suis ici donc pour parler
for quite some time, but also to acknowledge and appreciate the partners and the teams that have been doing this work. And so that's all I would say. And I'm listening and hope to see some, further discussion about about what's next with regards to improving the lives of young people. Thank you very much.
Merci, Catherine. Beryl, Catherine travaille avec vous.
Thank you very much, Beryl. Catherine, with you. Can you give us a small summary? You can also share with us, and you can also share your perspectives. Go ahead, Beryl.
Merci beaucoup.
Thank you very much. I'm sorry, Beryl, your network is not good. We cannot hear properly. Your line is not clear. I'm so sorry. Your network is not good. Just try again. Hello?
Okay. Allô?
Yes, try again.
Allô, vous m'entendez bien?
Yes, can you hear me well?
Très mieux maintenant. Vas-y, s'il vous plaît.
Yes, it's much better. Go ahead.
Ok, donc pour résumer ce que Catherine a dit, elle a remercié tout le monde d'avoir pris de leur temps pour prendre part à ce webinaire et elle est là pour plus écouter, de voir comment ce webinaire peut nous guider vers un consensus pour faire face aux problèmes auxquels les adolescents de 10 à 14 ans font face dans les différentes régions et les différents pays. En résumé, c'est ce qu'elle a dit. Elle est là plus pour écouter que pour participer directement. Quant à moi, ma question est relative à plus ou moins la méthodologie. Quelle a été la méthodologie utilisée dans les différentes régions? Est-ce que c'est la même méthodologie? Est-ce qu'on a pris le temps de faire une étude qualitative en plus de l'étude quanti? Parce que quand on me dit qu'il y a 1400 adolescents qui ont pris part à cette étude, je me demande comment le côté qualitatif a été pris en charge. Donc, je voulais savoir juste
Merci, Beryl.
si le côté...
je suis sûr que Cara peut expliquer les différents moyens qu'elles ont utilisés, comment
were used and how, and we can give the floor to Dienaba.
Dienaba Ndao, est-ce que vous êtes là?
Dienaba Ndao, are you there? Do you want to say something? Thank you very much, Chandra. I think that I will not answer your question. So for Senegal, it's the same thing than the sub-region. Adolescents are really exposed to early pregnancies, early marriages, and we can see that there are many young girls that are affected in most of the countries, and we need to empower the young girls. And if we empower them, it will really make the situation better. And they also need to listen to sexual education that is not really happening in most of the school. But we also have a program that we call the New Deal. It means that the young girls tell their parents that they will not have sexual intercourse outside marriage, and so it means that also the parents will not give them away for early marriage. So it's I can tell you that the young girls they are married early, and the parents most of the time want to give them, because a pregnancy that is outside the marriage is actually a shame for the parents, and that is why most of the parents want to marry them early so that that does not happen. And I think that we are working against that, and if we do that in most of the countries, the young girls can be more empowered. And Chandra, the summary that what you've given is also valid in Senegal. Thank you, Jenaba. And I would like to say that the group of young people that are very important, and we also develop the environment and to see to give them a possibility to find a job, and also to protect them from sexual aggression. And we need to do those two things together. for romantic relationship during the adolescence period. And I can tell you that our friend Robert has posted something very important in the chat. And maybe Robert, you can also post the comments in French. And if we have the time, we can share. You can share with us. So
7 to 8 minutes to answer these questions and make any points you want.
Merci, Chandra. Donc, je vais...
Thank you very much, Chandra. So I'm going to answer to the questions of methodology. And we led qualitative research during the formative stage, and it really clarified the development of the quantitative measures that we use in each country. So in the second phase, we are using the same methodology in each site that was principally quantitative. In our sites that have interventions, they also led qualitative data, and you can see that the results in our website. And maybe Trevor, you can put a website link in the chat so that everybody can see all the documents about the quantitative and qualitative results for the project in each site. For the questions as far as romantic relationship for adolescents is concerned, like I had said before, the romantic relationship are not very prevalent for the young adolescents, in particular for the very young adolescents. But I can tell you that the survey and the study, in the survey, you say what are the perception and the various attitudes on the romantic relationship to see if these attitudes or behaviors actually affecting the romantic relationship during the adolescence years and also during the adulthood. So we use the results for the young adolescents and to see if there's an effect on the various perceptions, on the various behavior during their youth. Maybe I can also give another point, and that is actually to respond to someone who said that the results maybe are very different between the urban and rural context. I do believe that that is something that is very important. It's a very important point. And I can say that GAS actually the urban communities only, and the disadvantaged communities in the urban setting. So we cannot talk about the rural problems with this study, but I do believe that it's very important to examine the two. And we have many resources and many rural surveys, but here we are talking about the effects for the urban adolescents. And after that, I think that I've responded to all the questions, and I would like to give the floor to other people if they have other questions or other experiences to share with others. Thank you very much, Kara, and our friend and our dear colleague, Eric Mufuta from the University of Kinshasa. And next week, she's going to share with us the work that they've done, the work that they've done. So Kara explained the 5 waves and the bigger number of waves in the 15 sites for the study that was done. And Eric, I just want to give you the floor. Do you want to say something so that we can really make sure that we have more people that will come for next week's webinar? So thank you very much, Chandra. Can we see your camera, your video, Eric? So we are really pleased to participate, and Kara gave everything. So for DRC, generally speaking, like it has been said, we've observed that Eric, are you there?
Plus vous avancez avec l'âge, plus
yes, with the older you get, these relationships actually appearing. That's something that we found. But generally speaking, parents do not appreciate that, and they do not authorize such a relationship. So for the qualitative studies, like Kara said, we did some studies in a formative stage, but with our partner Save the Children that are actually implementing the intervention process. There are many studies that have been achieved in the qualitative aspect so that we can follow different others aspects that actually came out from the study. For example, the impact of the big brother and big sisters, the appreciation of the parents vis-a-vis the tools that we avail for the young people in the program and their reactions as far as the results of the programs are done. So many qualitative research have been done. So we are going to give you a summary next week with the time that will be allocated for our presentation so that we can share with you next week. Thank you. Thank you very much.
Can I please have my video, Peter, and can Kara have her video? Merci, Eric. Bienvenue.
Thank you very much, Eric, and well done and welcome. We have 2 to 3 minutes just to say that we are going to share. We are going to share the slides that we've been using today, and we're going to share them, the French version and English version, and even the slides that we used last week. We also translated 5 articles, and we are going to share these articles in French and in English. I don't know if Ndeye would like to say something to close. And Kara, you have a last word? I just wanted to say thank you for the opportunity that you've given me to speak today. And I would like also to thank you for the very good discussion on the gender subject and also the issues of the young adolescents. And I would like to thank you. You can send me the other questions. If you have other ideas, do not hesitate to share with me. Thanks again. Thank you very much, Kara. Kara is going to be with us next week, and we can continue the discussion with Kara and even with Eric next week. Ndeye?
Merci, Chandra. Je remercie
Thank you very much, Chandra. Thanks to all the participants that are here for this webinar. And I do believe that all the presentations are going to be sent in the chat box. Many have mentioned that they haven't received yet. So we are going to send them via email. And we hope to see you for the next week's webinar. Thank you. And back to you, Chandra. Thanks, my friends. I would like to thank Kara, Trevor, Peter. I would like to thank Ahmed and Deye, and even you, the participants, for this meeting. It's the end of the day, and I'm really pleased that you came, that you stayed with us, and thanks to all the interpreters for the very good job that you've done. Vincent, Brandley, big thanks.